If you wake up every morning and you never know how your gut is going to behave, you don't know if you're going to have abdominal pain, gas, bloating, diarrhea, or constipation, and you don't know which way your day is going to go, then chances are that you are one of those 10 to 20 million Americans who's suffering from irritable bowel syndrome. And it can be quite a debilitating condition. So, what are the main symptoms? So, those are abdominal pain, gas, bloating, and alternating diarrhea or constipation, or dominance of one or the other. And the typical thing is that these symptoms last very long. So people don't really quite get rid of these symptoms, and they often struggle with their gut problems. So the challenge with irritable bowel syndrome is that we don't really know exactly what are the underlying causes. We know there is a strong gut-brain connection, and that is probably one thing that is at the root of all these problems. But the good thing about irritable bowel syndrome is that although we don't know what is the major underlying cause, we know that everybody has some triggers that can provoke the symptoms. And if we can manage those triggers at an individualized level, then the symptoms can be improved very tremendously. So what are those triggers? Mostly those are related to foods. So how can we identify triggers related to foods and manage them? Well, the first thing we can do is we can do food sensitivity and food allergy tests and see what particular foods are triggering your symptoms. If you don't want to do quite that, then you can also do an elimination diet, which is basically not eating a lot of foods and just eating a handful of very few simple foods for a few days, and then introducing one group at a time and figuring out which one is basically causing the symptoms. The next possible option is doing something called low FODMAP diet, and this diet has been studied extensively and has some promising results. Basically, this means that you don't eat foods that are high in fermentable oligosaccharides, monosaccharides, and disaccharides, and polyols. So those are all the foods that are basically related to gluten, dairy, certain fruits, and certain vegetables. And you can get a list of those foods and remove those from your diet and see if your symptoms improve. So that's the generic approach. But then, of course, you can become very specific and do the test as well. Now, it is not just the foods necessarily. Sometimes people do everything they can in order to just kind of customize their foods and their diets, but they still don't quite get rid of the symptoms. And why is that? That's because there are many other things. For example, there is stress that can trigger the symptoms. There is lack of sleep that can trigger the symptoms, and then certain medications can do it too. So we need to make sure that we avoid all those triggers. In women, menstrual cycles can do it as well. Now, after we have managed the triggers, and we've tried to figure out how to identify those triggers, if there are a few other things that you can incorporate in your management to get further improvement of your symptoms. So what are those? Those are exercise. So studies show that a good exercise or aerobic activity program can improve the symptoms of irritable bowel syndrome. It has to be done regularly because exercise is movement. So if we are not moving, our gut is not properly moving as well. And proper movement of the gut or peristalsis function is necessary for resolution of the symptoms of the irritable bowel syndrome. The next thing is fluids. So oftentimes dehydration can lead to stasis of the gut. So there is stagnation, and then people can suffer from exaggeration or exacerbation of symptoms of IBS or irritable bowel syndrome. The next thing that you can do is look at your microbiome profile and see if you have any dysbiosis. So oftentimes people with IBS have dysbiosis or imbalance in the microbiome in their gut. If we can fix that with the help of proper probiotics, broad spectrum and good strain containing probiotics, then also symptoms can improve. The next thing is, or probably the last thing is, the role of medications. So of course medications can be used, and those are very helpful and beneficial, but those should be used only in conjunction with all the other lifestyle related interventions and identification of triggers and resolution of those triggers. Because if we don't do that part, then the medications don't really work as well. And oftentimes, vast majority of the patients do not need to take medicines if they can just manage their lifestyle and take care of the symptoms of IBS. The medications basically include prescription medicines and over-the-counter medicines, and the prescription medicines are basically those that help patients who have predominantly diarrhea symptoms, or those that help patients with predominantly constipation symptoms. Now, what happens if you do everything, all of the above, take the medicines, and you're still not better? Well, then chances are there are additional diagnoses that are going on, or there are additional problems that you're suffering from, and one of those is SIBO, or small intestinal bacterial overgrowth. So we can talk about that also, and maybe manage that condition as well in conjunction with irritable bowel syndrome. Thank you.